Tonight, in the Alfred Hospital's intensive care unit.
Mum and Dad are here.
The fact that he's not woken up probably does indicate that there has been some level of brain injury that has occurred.
Big breath there. That's the way. Well done.
He would have eventually died without a heart transplant.
Look at his heart beating away.
The lungs are full of swine flu itself.
I think he has a high chance of dying.
The sickest patients, the most advanced technology, medical care second to none. It's always a matter of life or death. Peter's been rushed from Frankston Hospital to the Alfred.
He's a big boy. It's making a difference. He sat for 75.
He has swine flu and his lungs are barely functioning.
Thanks, Ryan. Yeah, grab everything.
Peter is about as sick as you can get, and he'll be quarantined in the intensive care unit.
Could be pure swine flu on its own, or it could be secondary infections. He's very seriously ill. He's critically ill, in fact.
He was at my birthday party a couple of days earlier. You know, a slight cough, and then a couple of days later in Frankston Hospital ICU. Never happened like this with anyone in the family on a life support machine.
Peter is being kept alive by ECMO, a heart-lung machine which has taken over the job of oxygenating his sick lungs.
By the time he got on ECMO, he was very unstable to the point where he only would have lived a few hours more if we hadn't had it, I think.
He had 10 and 10 on arrival.
So this is a X-ray of Peter's chest. It's markedly abnormal. Usually lungs on a chest X-ray are black with a few occasional white marks, and you can see he's got lots of white areas, which shows that the lungs are full of most likely infection or pus, either from the swine flu itself or from a secondary bacterial infection.
We've noted that in the last 24 hours his kidneys have also started to shut down, so we're putting him on dialysis as well as the ECMO.
We ready to go with that?
Yeah, that is good to go.
Whatever's attacking Peter's lungs, swine flu or a secondary infection, it could kill him. The team needs to figure out what's going on, and fast. "20-year-old Aaron has just arrived in the cardiothoracic pod after a heart transplant.
I'll just come down on the adrenaline a little bit as well.
Aaron had been suffering from dilated cardiomyopathy, a disease that left his heart weak and enlarged and unable to pump blood efficiently. For the past 6 months, Aaron's been kept alive by a mechanical heart while he waited for a donor heart to become available.
He had a bit of clot in part of the mechanical heart, which really worries us because there's a risk of that flicking off and causing a stroke. So we were delighted when a heart became available. He would have eventually died without a heart transplant.
No significant blood loss. Everything freed up really nicely. And we had about a 15-minute wait and then the heart arrived, so not too bad.
For twin sister Laura, Aaron's new heart is a godsend.
He gets a second chance at life, and that's, I think, more exciting for us as well as him. You're going to make me cry. He was so good.
5 of Aaron's 7 sisters also have cardiomyopathy and know only too well what a life-saving operation this has been.
You've done so well. When Mum passed away, she had the same heart condition, and she passed away 3 years ago, and I think she played a part in getting him through today, so she'd be proud. Look at his heart beating away. He has a heartbeat back.
Aaron's surgery has been successful, but he's still at risk. His body may not accept the new heart.
Occasionally after this sort of surgery, the heart can take some time to return to optimum function. So over the next 12 to 24 hours, we'll continue to monitor his heart function.
Clint, open your eyes.
Last time on ICU, Motocross racer Clint was brought to the Alfred after he crashed right on the finish line.
He collided with another boy on his bike mid-air.
Clint landed on his shoulder and head and knocked himself out.
This round bit here, the head of the humerus, should be fitting in that little circle there. It should be.
The break to his shoulder was nasty, and at first, Clint was sedated to keep him still.
You can see that the shaft now lines up with the head. 7, 8, 9, 10, 11 screws in there.
But once Clint's shoulder was patched up and the team started to wind back his sedation, it became clear that Clint's brain was injured too.
Clint's most recent CT scan shows a small amount of blood in several areas within the brain. This is the main one here. There's also a smaller one over here. Probably does indicate that there has been some level of brain injury that has occurred.
Could you do a few things for me, Clint, just to show me that you understand what we're saying? Would you be able to poke your tongue out for me? Oh, that's good. That's good. Excellent. Hey, well done. That's great. This is the most awake I've seen you looking in a few days, Clint. That's great, OK?
I think at the moment, Clint is probably suffering from what we often call post-traumatic amnesia, which happens to patients after they suffer a severe a traumatic brain injury, as Clint has had.
With such a devastating injury, Clint may never be the same. One day after arriving in the Alfred Hospital's ICU, swine flu patient Peter is still fighting for his life.
But what happens is occasionally his blood pressure will improve dramatically, but it's only temporary.
In addition to the swine flu, a secondary infection is rampaging through his body, threatening to overwhelm his life support systems.
Well, Peter became more unstable overnight. Essentially, the ECMO machine that we've been using to provide oxygen to his blood can't actually meet the demands of his own cardiac output. So his oxygen requirements are much greater than what we can provide with the machine. So our solution to that is what we've done today is we've put an extra cannula into his neck to try and increase the amount of support given through the ECMO.
If Peter's lungs worked, they'd supply some desperately needed oxygen. But they keep clogging up with mucus.
We're cleaning the lungs out continuously with bronchoscopy to try and get rid of all the secretions.
There's just a lot of pussy yellowish.
What our registrar is doing now is actually putting down a bronchoscope, so a camera down his breathing tube and down into his lungs. So it enables us to see what's down there for starters, and then also allows us to clear out secretions from his lungs. It's a normal set of airways and won't have anywhere near as much secretion. He's got quite a lot, so we've just got to keep clearing them out, really.
There's been an awful lot of action this morning with the new cannula and with the bronchoscopy, changing all his antibiotics and trying to do everything possible to optimise his care. But we've now reached a stage where we've gone as far as we can. We can't do any more.
Just going to suction in your mouth there.
24 hours ago, Aaron had a life-saving heart transplant.
You lift your head off the pillow. He's now awake enough that he's able to protect his own airway, and his X-ray is clear enough that we know that his chest is good and the heart's functioning well. So it's now time to pull the tube out and let Aaron breathe on his own. It's one of the biggest steps I think that these patients can take in the post-operative period. Just relax the hand, mate. I've got to get this tube out.
Deep breaths once you've done it.
Here we go. Yep, I'm down. Pull. Yep. Good.
Big breaths there. That's the way. Well done. Big cough.
Well done. You got a voice yet? Not yet. That'll come back, mate.
Aaron's post-operative recovery has been remarkably quick, an encouraging sign for his anxious sisters.
I've got my sister's wedding on Saturday, so I'm hoping they'll let me go.
As good as Aaron's feeling now, that's a little optimistic. In the trauma pod, it's been 15 days since Clint's motorcycle accident. He's been completely weaned off his sedation. Clint's drowsiness now is a result of the brain injury.
Everything's going along all right. There's a big eye.
Clint's still very sick, but for his mum and dad, every step forward is a cause for hope.
Better now? You feeling better? Yeah, when I see Clint being nearly his old self, or on the way to being his old self, pretty euphoric. Yeah, it's fantastic. But then if you come in the next day and there's nothing, you're on a bit of a downer again. But yeah. That's so you can't pull your tubes out.
Pull your tubes out. You've been a bit of a bugger with the nurses.
There's nothing wrong with your hand.
Yeah, there's nothing
but
wrong
you've been
with
pulling this out. Yes.
And you don't want that because that goes into your stomach and that's how you're being fed.
But he clearly doesn't need the ventilator anymore, so that's good.
Ward.
Yeah, I think query ward today, actually.
You're going up to the ward soon, but you're getting better. Okay?
You mightn't feel like it, but you are.
Clint's well enough to leave the ICU, but how much better he can get is the great unknown.
We're in uncharted waters with this brain injury, and everything's been a step in the right direction. How many steps are left? It's the $64 question.
In the isolation cubicle, Peter has continued to deteriorate.
Is Albumin's 14?
Intensivist Jason is really worried and has called a family meeting.
There's been a little bit of a change in Peter's condition today. From the point of view, he's become a little bit more unstable. But I think the problem now is the fact that he's so septic. And the word we tend to use is hyperdynamic, and all that really means is that everything's going at 100 miles an hour. So we just can't keep up. I think we've gone back to the situation where I think it's hour by hour again. I think he's critical. I think he has a high chance or a high risk of dying.
It's extremely tough. It's I haven't had to deal with that before. Basically, being looked in the face and being told that, extremely sick.
So, Clint, I'm going to go through some questions with you.
4 weeks after his crash, motocross rider Clint is struggling to overcome his brain injury.
Haircut.
Yeah, what do you call these, though?
Scissors.
Scissors, that's it.
Clint's about a month post-injury now, and Clint's got some impairments in his language and communication skills, as well as his memory.
What about this one here? Well, it's a clock, isn't it?
Yeah.
Sometimes he knows that he's in the Alfred Hospital, sometimes he's not aware of that at all.
So, Clint, you're going to go across to the rehabilitation hospital today.
Oh, yeah. That's what I'm here.
Yeah. So that's really good news.
I don't remember.
Okay.
I don't remember actually being here.
No. The longer that someone experiences these acute symptoms of memory and disorientation and general confusion, and also some of the behavioural changes that we see with Clint, I guess the worse off their outcome is. The positive thing is that he shows significant signs of improvement every day, but he's certainly got a long road ahead of him in terms of his recovery.
It's been 4 days since Aaron got his new heart.
How's the breathing?
Yeah, just a bit stalled.
A bit sore, so when you take a deep breath...
Today he'd hoped to go to his twin sister's wedding, but he's still recuperating.
I'm visiting Aaron here in the ICU today in my wedding dress because it is my wedding day, and he was going to walk me down the aisle today, but now he can't, so I thought I'd bring the wedding to him. You get to see me before anybody else. How do I look?
With his new heart on board, it's highly unlikely Aaron will ever suffer from cardiomyopathy again.
He was pretty close to dying, really, and I would be hopeful that with this now he can go on and live a normal life.
Very, very grateful. I'm very lucky. Very, very lucky. It's just a second chance at life.
After 4 days in the Alfred Hospital's ICU, Peter's tested negative for swine flu, but he's still going downhill. In a bid to isolate the secondary infection that's now ravaging his lungs and kidneys, intensivist Jason is replacing the main line in his jugular vein.
Peter's become a lot more septic and unstable. Some of the lines that he has in have actually been in since he was at the other hospital. And we've got to consider that these lines are potential sources of sepsis.
In an all-out attack on the secondary infection, powerful antibiotics and antifungal agents are being fed into Peter's body. But it may not be enough to stop the deadly infection from spreading further.
I've also noticed in examining him the sensation of a fullness in the right upper part of his abdomen. It's almost like poking into a balloon and feeling a block of cheese, which means that his liver is actually enlarged because it's come down below the rib cage.
Yeah, his toes look a bit blue and more toes, more so than yesterday. It's only a limited or a maximum amount of support that we can actually provide for him in terms of all his organs. So we're supporting his heart, we're supporting his lungs, we're supporting his kidneys now as well. In terms of his lab results, he still shows that he's got quite a big infective process going on. So it's difficult to say at this time how he will do. I think the family has been primed that he's still really, really sick.
It seems for Peter, the odds are stacked high against him.
Lynn's here and David's here.
He may not survive.
It's the biggest battle we've got.
Nearly 3 months after he collided mid-air on his motorcycle, Clint's brain has made a remarkable recovery. And today he'll discover the extent of the nerve damage in his arm.
So what we're going to do is we're going to study this right arm of yours and just see what's moving and what's not moving and why it's moving, why it's not moving.
Yesterday I had hydro and it just seemed to be moving a little bit better.
And here you can see how that's...
Noel and Barbara are hanging on every word. The tests will show if Clint's arm is likely to heal or if it will be permanently damaged.
One of the potential injuries in motorcyclists is that as they land on their shoulder, the head goes one way, the shoulder goes the other way, and they pull all the nerves out of the spinal cord up here. And that's a devastating injury. We'll try this muscle down here. That discharge there, they're muscle fibres that have lost their nerve supply. Whereas I think if we go to this one here, and when he lifts his finger up, push hard, he can activate so many motor units it'll fill the screen. So it doesn't look like any of the nerves are pulled out from the spinal cord, which is the worst possible scenario. If it's pulled out of the spinal cord, the likelihood of any recovery is vanishingly small. So nerves at the top, which are usually the ones that are most vulnerable when we fall off a motorcycle, to these muscles at the back here are intact. But the ones coming down midway, what we call the posterior cord ones, going down here are affected.
So there is things that can be done?
Oh yeah, there's quite a few things that they can do. They'll take little sensory nerves out of the foot or somewhere like that and patch it across the damaged nerve.
It's great news. It could take a long time, but Clint will eventually get back the use of his arm.
He may not get finer feeling, finer grip back in it, but he will be able to move his fingers.
When I first came here, they didn't think about his mum at all. So it's kind of good that I'm going to be able to.
In the cardiothoracic pod, Peter's been clear of the swine flu virus for 3 days, but he's losing the fight against the secondary infection. There's an air of despair in this corner of the ICU.
He's sadly now in a situation where the levels, both blood pressure and oxygenation, which we can achieve with him, are not compatible with life or survival. and therefore there's no point for us to continue because we can't get him better.
He's taken a large step backwards for just literally overnight. We think probably the infection is most likely taking over his body, and basically his organ systems are progressively failing now. In truth, I think his time is coming, really.
Next time in the Alfred's ICU.
Put out your tongue if you can hear me, Zach.
He's got 20 to 30 separate little areas of hemorrhage in that brain.
His passion was the Navy. That's where he's going in 3 days, which I don't think he'll get to now, obviously.
You've had your heart operation.
What didn't go to plan was that the new donor heart wasn't as strong as we'd hoped.
You stand in front of your mum and she could potentially die.
There is ongoing bleeding.
Bladder just gave way and fell 3 metres down into a timber deck.
The bleeding can be life-threatening.